Hey, Dr. Sandoval, I just want to double check my understanding of this problem before I dive in. It says, an infant weighs 34 pounds. What is the required IV flow rate in milliliters per hour to maintain proper fluid levels? I'm wondering if there's a standard formula or guideline I should be using for proper fluid levels that isn't explicitly stated, or if I'm supposed to infer it.
This problem has a common pattern in nursing calculations, Priya. It implies a standard guideline without explicitly stating it, which means you need to recall that guideline before you can even begin the math. You're right to ask about it. For infants, a common guideline for daily fluid maintenance is 100 milliliters per kilogram for the first 10 kilograms of body weight, 50 milliliters per kilogram for the next 10 kilograms, and 20 milliliters per kilogram for each kilogram beyond 20 kilograms. Now, looking at the problem, we're given the infant's weight in pounds and asked for an IV flow rate in milliliters per hour. What's the very first conversion you think we need to make to use our fluid guideline?
Okay, that guideline makes sense. So, since the infant weighs 34 pounds and the guideline uses kilograms, I'll definitely need to convert the weight first. I think I would multiply 34 pounds by 2.2 pounds per kilogram, right? So, 34 times 2.2 gives me 74.8 kilograms.
You're absolutely right that converting the weight to kilograms is the crucial first step, Priya. However, let's double-check how the units cancel out when you multiply 34 pounds by 2.2 pounds per kilogram. If you have pounds on top and pounds on top again, what does that do to the unit in your final answer? Remember, we want kilograms as our final unit. How should we set up that conversion factor to make sure the pounds cancel out?
Oh, right. I totally did that upside down. I should divide by 2.2 instead, or multiply by 1 kilogram over 2.2 pounds, so the pounds cancel out. Let me try that. 34 pounds divided by 2.2 pounds per kilogram gives me approximately 15.45 kilograms. Is that the correct way to set it up?
Yes, that's exactly right, Priya. By dividing 34 pounds by 2.2 pounds per kilogram, or multiplying by 1 kilogram over 2.2 pounds, your units of pounds cancel out, leaving you with kilograms. So, an infant weighing 34 pounds is approximately 15.45 kilograms. Now that we have the infant's weight in kilograms, how can we use our fluid maintenance guideline to calculate the total daily fluid requirement?
Okay, so for the fluid maintenance guideline, I'll take the first 10 kilograms at 100 milliliters per kilogram, which is 1,000 milliliters. Then, for the remaining 5.45 kilograms, I'll use that same 100 milliliters per kilogram rate again, giving me 545 milliliters. So, if I add those together, the total daily fluid requirement would be 1,545 milliliters. Is that how I should apply the guideline?
You've correctly calculated the fluid for the first 10 kilograms, Priya, which is indeed 1,000 milliliters. That's a great start in applying the guideline. However, take another look at the fluid maintenance guideline for the subsequent weight. Remember, it's a tiered system: 100 milliliters per kilogram for the first 10 kilograms, then 50 milliliters per kilogram for the next 10 kilograms, and 20 milliliters per kilogram for any weight beyond 20 kilograms. How would that change your calculation for the remaining 5.45 kilograms?
Oh, I see my mistake. I completely missed that the rate changes for the next portion of weight. So, for the first 10 kilograms, it's 100 milliliters per kilogram, which is 1,000 milliliters. Then for the remaining 5.45 kilograms, I should use 50 milliliters per kilogram. So 5.45 kilograms multiplied by 50 milliliters per kilogram is 272.5 milliliters. Adding those, the total daily fluid would be 1,000 milliliters plus 272.5 milliliters, which is 1,272.5 milliliters per day. Is that correct this time?
Excellent, Priya. You've correctly applied the full Holiday CIGAR guideline for the infant's weight. The first 10 kilograms indeed gives 1,000 milliliters, and the remaining 5.45 kilograms at 50 milliliters per kilogram gives 272.5 milliliters. Adding those together, the total daily fluid requirement is 1,272.5 milliliters. That's a critical step correctly calculated. Now, the problem asks for the IV flow rate in milliliters per hour. How can we convert our total daily fluid requirement into an hourly rate?
Okay, so since 1,272.5 milliliters is the total for one day, and there are 24 hours in a day, I just need to divide that by 24. So, 1,272.5 milliliters divided by 24 hours would give me approximately 53.02 milliliters per hour. Does that sound right for the flow rate?
That's precisely correct, Priya. You've taken the total daily fluid of 1,272.5 milliliters and accurately converted it to an hourly rate by dividing by 24 hours. So, an IV flow rate of approximately 53.02 milliliters per hour is indeed the required rate to maintain proper fluid levels for this infant. Congratulations, you've solved the problem. To summarize, we first converted the infant's weight from pounds to kilograms, then applied the Holiday CGAR guideline to find the total daily fluid, and finally divided by 24 hours to get the IV flow rate in milliliters per hour.
Oh, that's great. Thank you so much, Dr. Sandoval. I feel much better about this now. I really had trouble with remembering that tiered fluid guideline and setting up the weight conversion correctly at the start. It's good to see all the steps clearly now.